When it comes to red light therapy, more power isn't necessarily better. Longer sessions aren't always smarter, and wavelength matters more than people realize. I'm Dr. Jake Schmutz, a naturopathic medical doctor and integrative physician. Today we're answering the questions about red light therapy, wavelengths, and cancer support. So what wavelengths are usually used in red light therapy? So typical wavelength is about 630 to 850 nanometers. So why does the wavelength matter? So there's certain wavelengths that are better for specific medical conditions. And actually there's a certain wavelength in between like 630 to 670 that's been shown in the research to be the most therapeutic for helping the human body heal. And that is typically the best wavelength that we do for cancer therapy too. Is deeper red light therapy always better? So this is an interesting question. I would say we do, depending on what we're treating and where the cancer is, depends on how deep that we want it to penetrate. Red light therapy and near infrared light therapy do penetrate deep through the skin and can penetrate up to 4.5 centimeters. So if you have a good quality, high-powered unit, it's going to penetrate deep. But if you don't need to go deep, the power doesn't matter as much for like a topical case. But I would say that you still want a high-powered unit to have the best effect you want, but you want to make sure that it's at the appropriate wavelength, because that's what is the most important thing. Are at-home units of red light therapy reliable in treating cancer? I would say I think it's a good thing to have on hand, and I would say you get this little baby dose daily, but you do want to make sure you get a good quality bed that's a high-powered unit, especially if you have a deeper cancer that you want to treat, because the at-home units aren't going to penetrate as deep as the more high-powered units. And it doesn't mean that you just go to a clinic that they're going to have the high-powered units. You want to make sure you get a good quality product, like you want to get a Novathor or a Trifecta 450. Those are the machines that I know personally that are high powered, that have a lot of LEDs and have high megawatts per centimeter squared that we want to have the therapeutic effect we want. When we're going after cancer, we want to have the appropriate wavelength, 630 to 670, and we want to make sure that we have a high powered unit, especially if we want to penetrate deep. And also the more high power that you have, the shorter sessions that you need to do, and you don't have to do as long a therapy, and you're not going to get as hot. And sweating decreases penetration of the wavelengths going into the skin. So the longer you go, the hotter you get, the less penetration you get. So a shorter duration and not getting as hot and sweating as much, you're going to get much more high penetration getting in there and actually having the therapeutic effect that we want. So what are some things that cancer patients should avoid when pursuing red light therapy in treating cancer? So you want to absolutely make sure that you're getting the appropriate wavelength, like we've talked about, 630 to 670, because the other is not going to have the therapeutic effect we want. You want to make sure that when you're doing red light therapy that you have direct penetration to the skin. You also want to make sure that the LEDs are as close to the skin as possible so we get stronger penetration. The farther away the red light therapy is from the skin, the less penetration that we get. You also want to avoid certain lotions and creams. Many times we're showing in the research that decreases penetration, so I don't recommend any lotions and creams before doing a red light therapy treatment. But those are some cautions that I have. It's really not that it's going to harm you. You're just not going to get the therapeutic effect you want if you do some of these things that we just discussed here. The biggest question is not what is the strongest red light device. The better question is, what are we trying to support and how do we do it safely? If you want help building a safe, personalized, integrative oncology support plan, book a consultation using the link in the description. If you want to learn more about red light therapy, cancer, and treatments, go ahead and watch the video on screen now. We'll see you in that one.